Hi everyone, I'm Dr. Akhila, consultant fertility specialist with the hospitals, Banjara Hills, Hyderabad. Today we are going to talk about secondary infertility. So, coming to the definition of what exactly is secondary infertility, it is the inability to conceive, uh, having given birth to a child. It also includes it also includes miscarriages, and it accounts for about 11% of which is the incidence. So, when do we call it as secondary infertility? If the woman is less than 35 years and they have tried for about 1 year of unprotected intercourse. If she's more than 35 years for about 6 months and she has not conceived, this is labeled as secondary infertility. Uh, the very important thing is to understand what are the causes of secondary infertility. Having had a pregnancy before and now unable to conceive, we need to understand why this can happen. It can be because of some infections like tuberculosis, chlamydia, wherein the fallopian tubes are blocked. It can be because of the age, where the egg and the sperm quality is poor. Uh, Also, probably because of the age, if the egg number or the sperm number is less. Lifestyle, alcohol, smoking, sedentary lifestyle, poor dietary habits. These are some of the conditions that can also cause secondary infertility. Importantly, complications that have caused the secondary infertility occurring because of the first pregnancy, or there are some other complications, any surgeries were performed because of the first pregnancy. The most important thing nowadays is because of a previous cesarean section, if there is any isthmocele, which is a cesarean scar defect. So this also can cause secondary infertility. Most often this is missed, and this is the cesarean scar niche that is there, which needs to be removed. So that is when an appropriate treatment for secondary infertility. Also, if any DNCs or suction evacuations were performed and if it has caused any adhesions, this also is an important cause for secondary infertility. If there are any polyps or fibroids that are obstructive, these are also one of the very important causes of secondary infertility. When it comes to the males, problems in the semen analysis, that is, the counts are less, or the motility is less, um, varicoceles, these are again with respect to the male. Like any other evaluation, even secondary infertility involves a scan for the female with some blood tests, which include thyroid, prolactin, sugars. We need to rule out infections at the scan. We need to figure out if there are any polyps or fibroids, any endometriosis. PCO also can be because of can also cause secondary infertility. All these needs to be ruled out when it comes to the female, and when it comes to the male, obviously, a semen analysis, and based on that, if some other tests are required based on the counts and the motility, that also can be offered to the males. Now, coming to how to treat this secondary infertility, it all depends on what these investigations are. If everything is normal, then we can try ovulation induction with timed intercourse for about 2 or 3 cycles. If that has not worked out, then we can proceed on to do IUI for about another 3 or 4 cycles. If there are any abnormalities in the semen parameters, then we can directly go for ovulation induction with IUI. IVF also is an option for people with secondary infertility, though many may not be keen on going in for IVF because they already have a child, but some problems like tubal blocks, these actually we need to do IVF to overcome this kind of an issue. Importantly, if there is an hysterectomy, it requires correction. Most often, hysteroscopic correction with the receptoscope is what we do. Sometimes even laparoscopic, if it is too big, even a laparoscopic correction may be required. If there are any adhesions because of DNCs, like Asherman's, that also requires a hysteroscopy and adequate treatment, having released all the adhesions. Fibroids and polyps, obviously, they need to be removed. Submucous fibroids, especially, need to be removed. Um, this is the treatment for secondary infertility. Any questions, please? Yes. So this is what we're talking about. Men can become infertile after having kids. That is what is called a secondary infertility. So the first is usually a natural conception, and after which they're trying, but they cannot have children thereafter. And the various reasons are something that I have already discussed. Age definitely affects the fertility potential in men and in women, more so in women. Once you less than 35 years, the chances of conceiving are higher. From 35 to 37 years, it's slightly difficult. After 37 years, the ovarian reserve also comes down, and therefore the chances of conception also comes down. Also, the quality keeps decreasing with increasing age in both men and women. So this also is something I have discussed. How long should you try? If the age of the female is less than 35 years, she can try for about a year of unprotected regular intercourse. If she's more than 35 years, she can try for about 6 months. If any other issues are there, then we need to go for adequate treatment immediately. Yes, lifestyle is very important. Uh, Avoiding alcohol, smoking, regular exercise, good diet, adequate sleep, avoiding stress. These are some of the things that are of paramount importance when it comes to conception. The treatments offered for secondary infertility are based on what the problem is. We can try simple methods of ovulation induction with timing intercourse or IUI, or advanced treatments like IVF also can be offered to couples based on what the tests are. So with age, with time, semen parameters can vary. It is not abnormal that you had a child before and now it's becoming difficult. This is what is termed by secondary infertility. So you can take some antioxidants and probably try for IVF. Any other questions, please? Yes, after tuberculosis, you can definitely get pregnant through IVF because we don't squeeze the tubes when it comes to IVF. We give injections, get the eggs to grow, we take them, mix it with the sperm, create embryos, and this embryo is put back into the uterus. This is IVF. Of course, it is something that can be treated. We need to find out, we need to do all the tests that I mentioned, and we need to find out what is the cause of your infertility. If we find any reason that needs to be, if we find any cause that needs to be corrected, if there is no cause, we can try simple treatments like diving intercourse or IUI to be in touch. Thank you.